Hello, everybody. Welcome back to the next episode in our podcast series on growing healthy communities. Today, we're going to continue talking about using evaluation to understand and improve the initiative. Specifically, in this section, we'll be talking about providing feedback to improve the initiative. My name is Nancy Welch-Young, and I am so happy to be back as your guest host today. My contact information there on the screen in case you need it, but let's dive in and get started. So we want to talk about first, what is providing feedback? When we talk about providing feedback from your evaluation, we mean presenting the data on accomplishments that you're getting from your evaluation to those involved in the initiative, line staff and volunteers, as well as administrators and board members. So depending on the methods of the evaluation and the type of the data involved, some of it may be presented in the form of tables and graphs, some as narrative, and some even as portfolios or audio or videotape. Feedback, though, I want you to understand, is a two-way street. The folks engaged in the day-to-day operation of the organization and its programs can benefit from learning what seems to be working well and what doesn't, and from understanding what needs to be changed to improve results. At the same time, administrators and board members need to understand where the weaknesses in the organization are that keep staff and volunteers from being as effective as possible. Like, is there enough support? Are there enough supplies? Is funding adequate to get the work done? Is the organizational climate one of mutual respect that's conducive to staff and volunteers doing their best and to participants feeling welcomed and supported? These are questions that staff and volunteers and participants can answer at the same time that the organization grapples with monitoring results. To be really useful, feedback has to travel in both directions. Providing feedback should be done on an ongoing basis so that all can be kept up to date on what they're doing well and what can stand improvement. It can also be done at the end of an evaluation, although it's not exclusively so. In this section, we'll mainly be discussing the tracking of activities and accomplishments that may lead to longer-term outcomes, which is usually referred to as monitoring. So you may be wondering, why should we bother providing feedback? It takes effort, right? So why do it? Why do we put that effort into it? There are several reasons that you might want to consider providing feedback from time to time. Things like helping community leadership to assess progress that they're making towards meeting the goals of the initiative. It also can help to see areas where the members of the initiative may want to put more of their energy to make it more effective. It can also help detect when there's too much energy or effort being spent in areas that are not quite as important or central to the mission. To provide the opportunity to celebrate small accomplishments, giving feedback can also help the initiative focus on the big picture by seeing cumulative accomplishments over time. Another one would be that providing by giving feedback, you provide funders the opportunity to help redirect the initiative towards activities that are more directly related to the mission. And then finally, it also allows you to provide funders the opportunity to see and reward the accomplishments of the next initiative. So when should you provide feedback? Your staff really should get feedback at regular intervals, especially early on in the initiative's development. And that is so that they can continually adjust their efforts to improve the initiative's results. You might want to have feedback sessions once a month for the first year, and then after that, do them on a quarterly basis, like 4 times a year. Giving people feedback often gives them the chance to see what changes have resulted from adjustments they've made after the last feedback session. And that way you can all work together to continuously improve your efforts. Now we're going to get down to the nitty-gritty, how you should go about providing feedback. So the way you want to do that is beginning with an overall statement that sums up how the initiative is doing. This statement should be affirming. You don't want to start in on areas that need to be improved right off the bat. And it should be very specific about what is going well. So always start on something positive. For example, you could start out saying, we've received 35 letters from parents praising the school safety committee's work at Uptown Middle School. And that would be a much more specific and positive statement than to just say, a lot of parents are pleased with the school safety committee. So you want to give specific positive praise in the beginning. And then maybe if the data that you have gathered indicates that everything in your group has been going perfectly, That would be great. If that's the case, then presenting feedback to your group will probably be a breeze. But you know as well as I do, it's more likely that you're going to have at least a few areas or maybe even a lot of areas that need improvement. You want the people involved in your initiative to understand what they could be doing better, but at the same time, you will have to be very careful to keep them from feeling discouraged or angry at themselves, resentful, or insulted by less than glowing feedback, because it's going to happen. So think about how you want to do this. It would be a good idea to present the data to the group as a good thing. It's important that even if the feedback isn't all that positive, that after all, you're giving them information that will help them do a better job. So you want to try to communicate the value of a group that really wants to know how it's doing. Show them how using data gathered for your evaluation can help them do that. Provide a shared vision of the initiative as a catalyst for change. We can make a difference, and we will make a difference. And here's how we can do it. Communicating your optimism that way, that the group will ultimately succeed in having an impact, is very important. In other words, start off with the good news and then present any bad news in a way that encourages everyone to work hard to change it. And as far as showing graphs, there's an order that we suggest that you do that in. First, you want to show process measures. A number of people involved with the program, member satisfaction, amount of activity to make changes in the community relative to the group's goals. Those are all considered under process measures, and those go first. Then you want to show intermediate outcomes. The number of changes in the community, like new or modified programs, policies, or practices, information about the context of the initiative, and critical events. Those are the intermediate outcomes. Those come second. And then third, you want to show ultimate outcomes, impact of the data. So data from surveys of behavior change among people targeted in the intervention, community level impact data is what we're talking about here. So that's the third one. So the order again, real quickly: process measures, intermediate outcomes, and then ultimate outcomes or impact data. Also, you want to show non-graphic material. So although usually it's shown in graphs, and that's very helpful to have that visual representation, there might be some material that's best shown in a non-graphic manner. As we mentioned before, there may be a good deal of material like narratives, examples of participant work or learning, participant comments, that isn't best provided in graphic form. This kind of material also needs to be discussed differently, in that what it communicates may not be as clear-cut as the data presented in graphs. Like graphic data, though, non-graphic data can be examined in relation to process, intermediate outcomes, and long-term impact. Unlike graphic data, it might take some creativity to understand the trends or conclusions it demonstrates. So a trend would be movement in a given direction that isn't yet definite or far-reaching enough to be definitely said to have reached or failed to reach a goal. Much of this data might be best understood in discussion. What specific actions, methods, or conditions do participant comments refer to? And how could those be changed if they need to be? You might also want to think about, what does participant work show about the effectiveness of your work? And what do anecdotes illustrate about challenges and about things that need to be adjusted or eliminated? Most of this is qualitative data, data that can't or shouldn't, because it would lose the subtlety of what it can tell you, be expressed in numerical form. How you go about presenting the information can also make a big impact. So here's some tips on how to do this. You want to begin with positive information, like we already discussed. And you want to start by asking the group how they would interpret the data. If your interpretation is different, or if there are differing ideas among the group members, then you might want to discuss why that would be so and how to resolve the differences. Then give a more detailed example from accomplishments that have happened recently, like within the last few months if possible. Point out what's positive about the data. Discuss with the group any trends in the data that you're seeing and what those trends mean. Don't assume that everyone knows. Then discuss any suggested redirection of efforts, how they might do a better job of focusing on this part of the initiative rather than this other one. Redirect their efforts, and then review examples listed on the graph or in the qualitative information. Examples really help to clarify the information and clarify understanding for all group members. Affirm the initiative by noting evidence of progress. That's really important, like we've talked about before in previous podcasts on here, of how to keep the motivation up of all group members. So you always want to note the progress that you're making, especially if it's a long-term initiative, which they usually are. And then finally, you want to discuss any comments or questions that group members may still have. So that's a great way to go about presenting the information. But what about if the measure doesn't show recent growth? What do you do then? Well, in that case, you want to have the group discuss using the data why they think this might be so. So always have them giving input. That helps with their buy-in and their motivation to continue participating as well. You also want to point out any previous times that growth occurred to keep folks from getting discouraged. Many of these measures will be cyclical in nature. Resources generated, for example, often are recorded in spurts associated with funding deadlines. If it seems appropriate to point this out, do so. Ask the group for ideas about how to adjust the work in order to address the issue, if it needs to be addressed. And finally, ask if there were additional activities that were not recorded. List items that have been recorded over the life of the initiative. You might find things that didn't get recorded, and this could make a big difference in results. And the last thing I want to discuss with you is how to summarize the data by discussing the strengths of the initiative. You want to end on a positive note, always. You want your staff and volunteers to come away from this presentation with the resolve to work hard and improve the initiative, and you want to bolster their confidence that they can accomplish this. So don't let them leave feeling bad about their efforts up until now. Review the graphs and be sure to show the graph most directly related to the mission of the project, which most likely is going to be the graph of community change. So I want to wrap it all up by recapping the main things to keep in mind when you prepare feedback for your staff. First, you want to remember to present this data as a gift, informing your audience about how the initiative is doing. You also want to focus on the positive, always be affirming, convey optimism about the prospects for success, if this is appropriate, convey the need for changes or adjustment, if this is appropriate, and convey a shared vision of the initiative as an effective catalyst for change. Remember to keep it positive always and give lots of encouragement to the people working on the initiative. Feedback sessions are meant to make your staff and volunteers want to work harder and make the initiative better, not to dishearten them. That's the last thing you would want to do. So good luck in all your efforts. And now for the next section of today's podcast, I want to talk to you about refining the program or intervention based on evaluation research. Again, there's my contact information, but let's dive in. So what do we mean by refining the intervention? I want to talk to you about that. A community health center conducted an evaluation of its program to promote physical activity among those with higher risk for heart disease. The evaluation showed mixed results. A small number of participants, 15%, had very good outcomes. They had marked increases in physical activity and improved nutrition. Their fitness improved and they lost weight. As predicted, their blood pressure dropped, their pulse rates went down, and they reported feeling more energized. They reported high levels of satisfaction with the program and results. A large majority of the original group, 70%, exercised, but not as regularly as hoped. The health benefits for this group varied, with several reducing blood pressure at least slightly, and the rest maintaining the levels they had entered with. A final group, 15%, consisted of dropouts. Several participants left the program, most within a short time, and other people who simply never managed to exercise on any schedule at all. There was virtually no change in their weight, blood pressure, or sense of well-being, except for a small number that had relatively positive results. What could the community health center do with these results? It knew that while the intervention apparently worked if people stuck with it, the program was only partially successful. How could it use the evaluation to improve the program and so improve the health of those it served, which was the whole goal? Well, this chapter so far has discussed the elements of conducting a research-based evaluation, but evaluation itself is only a means to an end, a tool to help you see what is happening so you can improve the effectiveness of your work. In this section, we'll examine how you can use your research, the results of your evaluation to do just that. So what do we mean by refining the intervention? Data allows you and other group members to critically reflect on your work and look for opportunities to improve. So some key reflection questions that you and your group might consider include, what are we seeing? So like the amount and kind of activities implemented, results shown, increases, decreases, trends, that sort of thing. So you want to look at what you're seeing. You also want to look at, what does it mean? Like, what was the introduction of the intervention associated with changes? Also, what are the implications for improvement? Do the results suggest that the intervention should be sustained, altered, discontinued? What changes are suggested? That sort of thing. So what are you seeing? What does it mean? And what are the implications for improvement? The reflection questions that you ask will depend on the nature of your intervention, of course, but the above set of questions is a good starting point. Consider holding a meeting or brief retreat where the evaluation results can be presented through graphs and charts, like we talked about earlier, and key questions could be discussed. That kind of meeting might benefit from an experienced facilitator who can keep the process moving toward consensus for specific recommendations on how to improve. So always be thinking in that positive mode of how we can improve. Refining the intervention is the process of making your work more effective by using data collected from your evaluation. So depending on what you've learned from this data, you might want to increase or strengthen your intervention in certain areas or with particular groups, change or eliminate elements of the intervention that didn't work well, adjust your intervention to changing conditions or needs in the community. So those are 3 things that you might want to do with your data. It will be important for you to meet with other members of your group to review the data, identify key areas for improvement, and brainstorm and come to consensus on how to address issues that have been raised. Careful attention to your evaluation results can help inform which courses of action you should take to improve your efforts. So to continue with the example from before, the Community Health Center staff and selected participants met to review the results. They felt that the evaluation had shown that if people exercised regularly, they could lower their blood pressure, lose weight, and improve their overall health. A key implication of the findings was how to help people establish and stay with an exercise routine. Further dialogue about results of the evaluation left the Community Health Center with additional questions, like how can we increase the number of participants who actually adopt and continue regular exercise and other healthy behaviors? And why did some people who didn't exercise regularly reduce their blood pressure? And should we add another component like healthy nutrition to our program? Another question was, what other factors, if any, besides exercise seem to help participants exercise regularly and lower their blood pressure? A wellness group, medication, like what would work? So by focusing on the key reflection questions, what are we seeing? What does it mean? What are the implications for improvement? Remember those 3? The center should then be able to refine their program to get even better results for more participants. So why should you use your evaluation research to refine the intervention? Well, refining the intervention is the primary purpose of an evaluation. If you find out that your intervention wasn't effective, you have 3 choices. You can quit, you could blindly try another approach, or you can use your evaluation research to guide you towards a more effective intervention. Using evaluation results is vital. It points you in the direction that your research tells you is apt to be most helpful. Using research to help you choose your course of action also establishes you as a credible and practical organization, one that's concerned with what works. The kind of reputation is likely to increase your opportunities for getting funding and other resources, and to gain and sustain your community support. Most importantly, though, it helps the group succeed in addressing the important problems or goals of your community. So now let's talk about when you should refine the intervention. The short answer to this question is constantly. Monitoring and evaluation should go on throughout the life of the program or project. Do not wait until the very end to see how it's going. That's so that you can make adaptations and adjustments to what you do on an ongoing basis. In practical terms, it's wise to reevaluate your work regularly once a year is typical, and make any major changes at that time. Of course, you can and should make minor adjustments throughout the year based on your monitoring and on feedback from participants, staff, and others who implement or experience the intervention. There are, in addition, some specific times when adjusting your work could be especially helpful, like when what you're doing isn't working. If it's obvious that your work isn't having the desired effect, it's time to consider what you need to change. Make sure that you allow enough time for a program or intervention to have an effect, though, before you make a judgment that it isn't working. Nothing happens overnight, and the more difficult the issue you're addressing, the longer it's likely to take to influence intended outcomes. You have to walk a line between cutting a program off before it's had time to work and letting it go on after it's shown itself to be ineffective. So the next specific times when adjusting your work could be especially helpful would be when participants are dropping out at a high rate. What are you doing, or what are the external factors that might be causing participants to leave your program? You need to be taking a look at that and figuring out how you can change the intervention to assure that people experience it long enough for them to benefit. Another one would be between sessions of a time-limited or sequential program. Some programs, like the exercise program used as an example earlier, are only designed to run for a limited period, but may run again and again with new participants each time. If such a program is continually evaluated, you'll get and should use information each time that will help you make the next round of the program better. Another one would be when funders or participants ask you to adjust some aspects of your program. Your evaluation research should be helpful in determining how to respond to the funders or participants' requests. Another one would be when funding or other resources are reduced. You might be faced with eliminating parts of your program, cutting numbers of participants, or other unpleasant choices. Your evaluation research can help you find the best way to make cuts without losing your effectiveness by keeping intact the elements of the program that make the most difference. When the issue or goal changes is another one. Sometimes there is a shift in priority issues for the community following a rise in unemployment or violence, for example. Your research could tell you that and suggest ways of dealing with the change in conditions. So now we'll look at who should be involved in refining the intervention. The best plan here is to involve a number of stakeholders, depending to some extent on who has been involved in the planning and evaluation of the effort. Some people who should definitely take part, though, would be participants. These are folks who experience both the intervention itself and its effects, and they are likely to have ideas about what would make it better, easier for them to participate, or more relevant for them. Participants should be your partners in refining programs and interventions, since they have an inside perspective on whether they're working or not. Others would include staff members, paid or volunteer. Like participants, staff members have a unique perspective on the intervention. Not only do they see the way it works every day, but they'll also have to carry out any changes. If they can claim ownership of those changes by participating in the planning process for them, they are far more likely to understand them properly and be more eager to make them work. Others would include people who are directly or indirectly involved in supporting the work. Depending on the nature of your issue, these might include educators, government officials, health professionals, employers, funders. There's lots of others it could include. So that'll be specific to your effort. But since their contribution is needed to make any changes successful, it's important that they have input into the planning of those changes. They'll need to understand and support them if the adjusted intervention is to go well after all. Finally, those who have led and participated in the evaluation, they should be included. They'll have a good handle on what the evaluation showed and a grasp of what might be needed to be changed and how. For example, the Community Health Center put together a team to look at the evaluation results and make some recommendations for changes in the program. The team included a variety of participants who'd experienced different outcomes: a healthcare provider, a center board member, and a staff member from the university that conducted the evaluation. They went over some of the research that the center had used in developing the program and carefully studied participant interviews and other evaluation material, as well as the records kept by program staff. And now we're getting into the nitty-gritty, the meat of it all. How do you refine an intervention based on research? changes in interventions should be focused on one or more of the three aspects of evaluation: process, both your process, activities implemented, doing what you intended, and participants' process. What did they actually do? Then there's impact and then outcome. So process, impact, and outcomes. You have to examine each of these separately and ultimately integrate them together to decide what adjustments you need to make in your intervention as a whole. Each aspect of the evaluation builds on what comes before. In order to have the impact you want, you have to put together and run your program well, and that's a matter of process. If your process didn't go properly, then you haven't really conducted the program you planned for. If you didn't get the impact you hoped for, it may be due to the fact that you didn't do what you had planned. And the first adjustments should be to the process to ensure that the intervention is implemented as intended. Similarly, to get the outcomes you intend, the program has to have an impact on the appropriate risk and protective factors or other environmental conditions. If the program had the impact you envisioned, but not the outcomes, then adjustments need to take place at the impact level, perhaps in the risk and protective factors and/or conditions that influence outcomes. So now let's break each of those three steps down. So first we'll talk about process. That is an evaluation of the process of your effort, how it compares to what you plan to do with what you actually did. Process has a number of elements to which evaluation might be applied. They encompass both logistics, which is the handling of details like finding the space and buying materials, and program implementation like methods, program structure, and so on. These elements can include this list of things. So the list includes community participation. Were you able to involve members and sectors of the community that you intended to? Were you able to make good contacts and establish relationships within the priority population? Then there's community assessment. Did you conduct an assessment of the situation in the way you had planned? Did it give you the information you needed, in other words? Then there's program planning. Was the planning participatory? Did it include research into best practices and successful interventions? Did it result in an approach that everyone felt would work? Next up would be staff hiring and/or volunteer recruitment. Did you hire staff or recruit volunteers that were the right people for the jobs? What about staff and/or volunteer training? Were staff or volunteers oriented and trained before they started so that they knew what they were doing when they began work? And was there ongoing training throughout the intervention? Then there's outreach to and recruitment of potential participants. Was outreach successful to engage those from the groups intended? Were you able to recruit the number and type of participants intended? Implementation strategy is next up. Here, you're determining both what you actually did in implementing the program and what participants actually did. Did you structure the program as planned? Did you use the methods you intended to? Did you arrange the amount and intensity of services, other activities, or conditions as intended? Did you obtain and use the materials and equipment that you expected to? Did relationships develop as envisioned? Did participants actually do or experience what you had intended for them to do? Then there's evaluation strategy. Did you conduct the evaluation as planned? Did you gather data related to process, impact, and outcome? Finally, there's timelines and benchmarks. Did you complete or start each of these elements in the time you planned for? And did you complete key milestones or accomplishments as planned? If all or most things went as planned and any that didn't were trivial, you've essentially done what you set out to do. If they didn't, there are a number of possible reasons for changes in the intended process. Maybe it took more time than you expected to complete one or more of the important tasks. Finding and hiring key staff is a typical one here. Maybe it was harder than you expected to accomplish a particular task. This may be a matter of time spent, but it may also mean that you simply didn't have the skills or personnel to do what you needed to. Or maybe something you had good reason to expect didn't happen, like funding or support that you expected didn't come through. That's also very common. Maybe someone or some organization you depended on didn't come through, like a hired staff member became ill and didn't finish the work on time. Maybe more participants dropped out than you anticipated would. Maybe more people participated than you thought would. Partway through, maybe you found that the methods you had planned didn't work well, and you had to make adjustments. Or maybe a funder or a community advertiser board asked you to change some of what you were doing. Or maybe partway through, you became aware of a new method that seemed to be extremely effective and you switched to implement it. Maybe you discovered a more successful way of doing things in the course of the work and adopted it. Or you might have underestimated the resources necessary to carry out your original plan and had to scale back or look for more funding, more volunteer help, different space, or other types of support. You might have encountered opposition. You may have encountered unexpected difficulties if someone quit or materials or equipment weren't available from the supplier like you thought they'd be. You may have encountered disaster. The site may be burned down, or the program coordinator became ill, a staff member got arrested or misused your funds. These things happen. Or you simply didn't pay attention to following the plan, or maybe didn't do your job as an organization. You need to take a cold, hard look at that. The deviation from your plan may have had very little difference at all, or it may have made all the difference. Some differences might be positive. A delay might make it possible to find more stable funding source. A change in method might make for a more effective program, but there's still differences. It's worthwhile to understand what changed to make sense of the evaluation results and to make any needed adjustments. Perhaps you implemented your process according to plan and your program ran as intended. By contrast, the process may have been filled with difficulties, opposition, no community support, difficulty recruiting participants, missed deadlines. These things happen. Does that mean that all the work you put into planning was unnecessary? It's likely that the answer is the opposite. If you were able to carry off implementing a program regardless of the fact that your plans were disrupted, it's a good bet that the clear vision of what you wanted to do is what kept you on track. Taking a close look at how you managed to overcome the obstacles in your way will help you understand how to avoid them in the future. Avoiding all obstacles is unusual in any community work. The key is learning how to anticipate and overcome them. It's also possible that the process leading up to the program went as planned, but the implementation didn't turn out as expected. In that case, it was probably your plan that was at fault. So some possible problems that you might encounter could include not assessing the situations or take some important aspects of preparation into account. Maybe you didn't properly understand some aspects of what you had to do to be successful, or didn't properly communicate some aspects of what you had to do to staff, participants, funders, or the community. You might have underestimated the amount of money or other resources that you'd need, or you didn't have proper fiscal control over your budget. Maybe you ignored something important, like treating participants with respect, for instance. Maybe you didn't involve the community enough. Maybe you didn't factor in enough time for some aspect of what you had to do, like you planned for a given time period and carried that out, but it was too short. Maybe you didn't provide some important support for participants, like travel, childcare, or a stipend, and a large number dropped out as a result. So finding out why your plan didn't produce the intervention you expected can be helpful. Understanding what you need to plan for and how to do it can make your future work both more efficient and more effective. So now let's move on and talk about impact. We already talked about process, we're moving into impact. Your program or initiative's impact is the effect it had on the environmental conditions, events, or behaviors that it aimed to change, whether it was to increase, decrease, or sustain them. In most, but not all cases, the immediate impact of the program is not the same as the eventual intended results. Generally, a program aims only to influence one or more particular behaviors or conditions, risk or protective factors. The assumption is that such influence will then lead to a longer-term change, which is the ultimate goal of the program. So back to an example, the intended impact of the health center's exercise program, for example, is the adoption by participants of regular exercise, a protective factor in reducing risk for chronic diseases. The goals of the program, however, are actually better health, heart, and ultimately a longer and higher quality life. Impact is the intermediate step, the influence you have on a behavior or other factor that will in turn lead to the intended results. Your process might have gone perfectly. You might have done exactly what you set out to do and might still have had no impact on the risk and protective factors you targeted. By the same token, you may have ended up running a program markedly different from the one you planned and still have had the impact you hoped for. The results of the process evaluation will tell you how closely you stuck to your plan in setting up and running your program. The results of your impact evaluation will tell you whether your program made the changes or intended results. Your program worked as you planned if the behaviors and risk or protective factors changed in the ways you intended. The big question that remains in this case is whether the changes your program influenced led to the ultimate outcomes you were working toward. We'll consider that when we look at outcomes a little later in the section. In all these cases, evaluation should involve feedback from both participants who had good results and those who didn't. What worked particularly well for those who had success? What were barriers to those for whom the program didn't work well? It's not always easy to get participants to describe these positives and negatives, but it's the best way to find out. If your program actually had a negative impact on the targeted behaviors or risk and/or protective factors, the intervention aimed to increase childhood immunizations and fewer children were immunized, for example. It is important to look more deeply into what is happening. So some possibilities might be that you failed to communicate your message or its importance. Maybe you underestimated or ignored cultural influences that were powerful enough that your methods failed to overcome them. Or you didn't take into account cultural differences in participants' lives that made it difficult to achieve intended results. These factors could include poverty or competing demands for time, among many others. The cultural incompetence of the organization or some staff members worked against your goals, or the structure or methods of the program led to unanticipated negative consequences. Or perhaps the program was seen by participants as something that was being imposed on them, and they had little influence on its design or implementation. We've talked before about the importance of buy-in. So just as you might find that your process went well and your program still didn't influence the risk and protective factors you meant to, it's possible that you created exactly the changes you intended in risk and protective factors, and the program still didn't achieve the outcomes intended. We'll look at outcomes to consider that situation. The outcomes of an intervention are the changes that actually took place as a result of it. The goal of an intervention is usually not just a change in behavior or circumstances, but the changes in community health and development that occur as a result of that immediate change. A tobacco control program, for instance, aims to help participants avoid or quit smoking. That's its impact. Its real goals, the hoped for outcomes of the program, are reduced rates of heart disease, lung cancer, and other smoking-related diseases for participants and their family members. The ultimate outcomes may take years to assess, but others, like the blood pressure goals of the health center exercise program or the results of the job training course, can be determined at or soon after the end of the intervention. Outcomes are the true measure of the success of the intervention because they are the reason it was conducted in the first place. However, the impact made, such as changes in community programs or policies, can be an important intermediate outcome since it can take years to see changes in longer-term outcomes. The program produced the intended outcomes. If the program produced the outcomes you intended, congratulations, you've achieved the goals of your effort. Pat yourself on the back. This isn't the time to consider your work complete, however. How can you make the intervention even better and more effective? Can you maybe expand or strengthen parts of the program that worked particularly well? Are there evidence-based methods or best practices out there that could make your work even more effective? Would targeting more or different behaviors or risk and protective factors lead to greater success? How can you reach people who dropped out early or who didn't really benefit from your work? Think about also how can you improve your outreach? Are there marginalized or other groups that you're not reaching? Can you maybe add services, either directly aimed at program outcomes or related services like transportation that would improve results for participants? Can you improve the efficiency of your process? Can you save time or money without compromising your effectiveness or sacrificing important elements of your program? Good interventions are dynamic. They keep changing and experimenting, always reaching for something better, because programs can always be improved. Now let's talk about what if the program only produced some of the intended outcomes. If the intervention produced only some or some lower level of the desired outcomes, you may be headed in the right direction. The program may also have greater effects in the long run as participants incorporate the changes they've made into their everyday lives. Some possible reasons, though, for the program's effect not being as great as you had planned might include that you didn't target sufficient risk or protective factors. Maybe the program's message didn't reach participants or speak to them in a powerful way. Maybe there were intervening factors, attendance or lack of support services, that made the program less effective than it could have been. Maybe particular parts of the program didn't work well, or particular parts of the program weren't implemented well. You may have overestimated what was possible in the time available, or the program may not have approached participants in the right way. Like if it was too formal or the language that was used posed barriers for some. Maybe the program wasn't culturally adapted for the right population, or there were conflicts among participants or between participants and staff. So for example, let's say that the health center's exercise program wasn't by any means a failure, but it was only modestly successful. How might the health center use its evaluation information to improve the results for program participants? First, the center could examine what participants said about the program. What enabled the members of the most successful group to exercise? Why weren't members of the much larger group able to establish regular, effective exercise routines? And for members of the third group, those who didn't exercise at all or dropped out quickly, what might have gotten them more motivated? Perhaps those in the first group attended all the sessions and found exercise partners who challenged one another to do a little more or to eat a little better. Perhaps those in the other groups did not locate partners. Based on the evaluation, the program's designers decided that they should arrange for exercise partners or groups for everyone. It seemed from the evaluation that both the social situation and the challenge that exercising with others presented made exercise more likely and more fun, and promoted a more vigorous workout. They also decided to develop a much more formal nutrition component to the program and to incorporate a buddy system into that component as well, in the hopes that participants could help one another develop recipes and stick to a reasonable eating plan. But if the program produced no outcomes at all, you may have to make big changes. It can be very difficult to admit that you've been taking the wrong direction, especially after investing a lot of time and effort in planning and implementing a program. It's tempting to believe that if you just work harder or recruit different participants or use better materials, you'll get the results you want. It takes courage to conclude that the results call for a major redesign in the effort. The program may have produced unintended outcomes, either positive or negative. If they're positive, you might want to understand how they came about so that you can continue to produce them. If they're negative, you'll probably want to learn more so you can seek to eliminate them, of course. Most of the reasons for unintended outcomes are similar to those for lack of outcomes. Here's an example. A positive unintended outcome in a youth violence prevention program might be better school performance. A negative example in the same program might be an increase in school dropout. Teens in the program might improve their school performance because they admire a staff member with a college education and want to be like him or impress him. Or they may see college and an escape from the neighborhood as their best way out of a cycle of violence. Those who drop out of school as a result of the program may also do so because they see it as a way to avoid violence. School or the trip to and from school may be especially dangerous because of the presence of youth from other neighborhoods or rival gangs. Conversely, they may see dropping out of school in favor of work as a nonviolent road to financial success, as opposed to dealing drugs or some other similar violence-prone activities. Given all this, how do you approach your evaluation research to decide what you need to refine and how? A good general approach is to work backward from outcomes, asking "but why?" regarding why each previous phase failed to produce the results you wanted. Using the "but why" method to examine outcomes is what we're going to talk about next. Examining the outcomes. So if your intervention achieved the intended outcomes, it has done its job. Now you can consider how to maintain these effects or refine your program. You should still examine the results, though, for process and impact and make changes where they'll gain you greater effectiveness or efficiency. But chances are the program doesn't need major changes unless you want to enlarge your goals or unless you have found an alternative approach that could lead to even more impressive outcomes. And then examining the impact. If your evaluation research shows no outcomes or outcomes that fall short of what you intended, the next area to examine is the impact of your program on the targeted behaviors and risk protective factors. If the program had the impact you expected but no outcomes, perhaps you've chosen the wrong behaviors or factors to target and need to rethink your problem analysis and related intervention. There are other plausible explanations. Your intervention wasn't in place long enough, the effects are delayed, your measures are insensitive to what's being achieved. Then you want to examine the process. The next step here is to understand how well you planned, prepared for, and implemented your intervention. If the reasoning and assumptions behind your planning were accurate, and if you set up and implemented your program based on them, then you should have the impact you were aiming for. And that impact should lead to the outcomes you intended. If your program didn't go as planned, that could be a good part, if not all, of the reason for your lack of outcomes. Your process evaluation can show you where you need to adjust and improve your implementation to have a better chance to get the intended results. If your program did go as planned, you met your deadlines and did what you intended to do in the way you intended to do it, and you failed to achieve your goals, there's a good chance that your planning was the problem. You may have aimed at insufficient risk and or protective factors, as mentioned above, or you may have chosen ineffective methods to influence the right ones, or both. There are other possibilities that could be picked up by a process evaluation as well, many of which have already been suggested. Treatment of participants, language or other communication issues, lack of cultural competence, and so on. Identifying and correcting these kinds of problems can help a program reach success. Finally, you want to keep making adjustments. Make your adjustments and refinements. Run and evaluate the intervention and make further adjustments and refinements to keep improving your work. This should be a continual cycle for the life of your program. So in summary today, I just want to say that the purpose of an evaluation and the research that goes into it is not just to tell you whether or not your intervention has been a success. The real value of evaluation research lies in its ability to help you identify and correct problems, as well as to celebrate progress. Evaluation can pinpoint the strengths of your program and help you to protect and enhance those strengths and make them even stronger. By examining the three elements of an intervention, process, impact, and outcomes, your evaluation can tell you whether you did what you'd planned, whether what you did had the influence you expected on the behaviors and factors you intended to influence, and whether the changes in those factors led to the intended outcomes. That knowledge can show you what you might change to improve your program, as well as the overall effectiveness of the intervention. And the information can be used to celebrate the accomplishments you are making along the way. Thanks so much for joining me today. As always, our contact information is on the screen. You can find me or Ashley's story there. And you could also follow us on Facebook for updates and a lot of other tools and resources about this podcast series and other things that you might need. We look forward to seeing you next time. Thanks for joining.